and join us. So I want to welcome everybody today to our community conversation. And we're holding it on a very important day, which is National Rural Health Day. So I would love to do introductions and then kind of move into a little bit about what National Rural Health Day is, and then talk a little bit about some of the realities of what rural means for Oregon, and then have some great questions for you all, our esteemed panelists. So Steph, if you go to the next slide. So again, welcome everybody, and I'm excited to introduce our three panelists that are with us today. Dr. Dean DeFries is a family physician in Eastern Oregon Medical Associates St. Luke's in Baker City. Dr. Leslie Ogden is the CEO at Samaritan North Lincoln and Pacific Community Hospitals in Lincoln City and Newport, respectively. And Ray Hino is the CEO at Southern Coos Hospital and Health Center in Bandon, Oregon. So I want to thank all three of you. I know your schedules are busy, and to take this time on today, I really, really appreciate it. And so look forward to our conversation coming up. So next slide, please. So what is National Health Day, and why are we celebrating it? So just a funny aside, the National Organization of State Offices of Rural Health, which is the national organization for offices like mine, is holding a reception in DC today with the Congressional Rural Health Caucus on the House side. And we've been all very, very excited for this reception, and the caucus chairs from Hawaii and Alabama have been very supportive and are going to be there. And everybody was solidly confident that they would not solve the budget issue and go home. And yet the day before our reception in DC, the House passed their continuing resolution and went home. So our fingers are crossed. I haven't heard yet how many people showed up. But so National Rural Health Day was started a number of years ago by the National Organization of State Offices of Rural Health to really celebrate rural health. We're often told that we're older, sicker, poorer. Those are probably the three things you hear every time we talk about rural health. And while that might be kind of true, rural health is so much more than that. It is so much opportunity, and so it needs to really be more than those three statements. And so we created National Rural Health Day to celebrate what it means to be, what rural health means in each of our communities. And so it happens the third Thursday of every November. And I'm sorry, I didn't get until today. The White House actually released a proclamation for today as well. And the U.S. Senate is taking up a resolution as well for today. So, but it is a day to really talk about the positive things that go on in rural. And I think the three of you, as we talk today, are going to really, really be able to highlight what that is and what it really means to be in rural health today. So next slide. So what does Oregon look like, or what does rural look like in Oregon? Well, as most people know, the definition of rural in Oregon is set by the Office of Rural Health, where all geographical areas 10 or more miles from a centroid of a population center of 40,000 or more. We're a pretty diverse state and very large. So rural on the western side of the state is going to look different than rural on the eastern side, and rural in the northern parts of the valley are going to look very different than the south and the southeast parts of the state. So with a lot of support and work over the years with all of the constituents, we have kind of held to that definition to really help us look at what rural is. And frontier is any county with 6 or fewer people per square mile. So 10 of our 36 counties are frontier. And Dean, I think you are right in the middle of one of those out in Baker City. So out of our population of 4.3 million, which is that 2022 population statistic, 34.7% live in rural or frontier communities. So that's a lot of people. And I think that we are quick to say, well, everybody lives in Portland, Salem, and Eugene, and everybody else is an afterthought. And I think these statistics show that that is in fact not true. And we often talk about the quote unquote whiteness of rural Oregon. And we have to remember that 14.2% and growing of the population is Latinx Hispanic, and that continues to grow and is really, really important to pay attention to, because the diversity of our rural communities mean that we need to look at how we address our communities and their healthcare needs in different and unique ways. Next slide, please. So a little bit more, 23.6% are of the age or over the age of 65. So we do, in fact, have an aging population, particularly when you compare it to the urban areas of the state. And in the 2020 per capita of non-metro Oregonians, our income was $47,151, which is about 13.7% below the, sorry, these shouldn't have said that so quickly together, because so it is 47,000, but about 13.7% live at or below the federal poverty level. Well, you can see the income for the metro area and the poverty levels are a little bit lower. Next slide, please. And I just put these up there, and these slides are available if anybody who's attending today wants to have them. It just points out some of the differences in between frontier, rural, and urban, and the average across Oregon, including unemployment, disabilities, and those pieces. So next, the good old visual of what rural and urban looks like in Oregon. So you can see the darker green areas are frontier counties. So those are our 10 counties of 6 or fewer people per square mile. The light green is rural and the orange is urban. Next slide. I just wanted to give everybody kind of an idea of where our critical access hospitals are, our 25 bed and under, kind of spread throughout the state. And here are our rural health clinics, currently 114. That number's always changing. And this is a map that just sort of shows where a number of the different healthcare facilities are: RHCs, federally qualified health centers, tribal, as well as the CAUSE. So that's a little bit about Oregon, and with a touch about National Rural Health Day. But one of the interesting things about National Rural Health Day, and one of the things that NoSOR did, is to really talk about who the community stars are in our rural communities. Who is out there doing things that are important and helping with the success of rural health. So back in 2015, we started the Community Star Recognition Program, and every year since, we states have been nominating, and NoSOR has been awarding the various stars. And so I thought I'd go through a couple of those stars here. So next, please. We've had the Gorge Native American Collaborative be one of our stars back I believe these folks were 2017. Next. Leonard Wayne Ellsworth, who is down from Southern Oregon, was in, I believe, 2017. And interestingly, a couple of these folks came about with what we didn't even know. So the really cool thing about this is these are people who are paying attention and really wanting to support the heroes in their communities. And Bobby, she is a great one, and I think is also shows that while our providers are key to the success of our rural health delivery system, it goes much beyond that. And Bobby has been working in the K-12 system, supporting healthcare education down in Lakeview, and did throughout her retirement as well. So it just shows that health and healthcare are two different things, and the health of our communities relies on people well beyond our providers as well. Next. Claire, who is from Ione, one of the clinical coordinators, was one of our stars a number of years ago, as was Eric Thorson out here in my town of Astoria, the CEO for the Columbia Memorial Hospital. Stacy Reed, one of our former Office of Rural Health employees, who's worked with many, many rural facilities and their recruitment efforts, as well as a lot of students and matriculated students coming out of medical school and nursing and PA. And our own Leslie Ogden, who was the star back in I believe it was 2019, if I'm correct, Leslie, if I think if I remember that date. And so the interesting thing putting this together is we couldn't really, I couldn't finish this until this morning because NOSOR doesn't announce their community stars until National Rural Health Day itself. So I am pleased with the next slide to announce who our 2023 community star from Oregon is, and it happens to be Ray Hino, who's here with us today. So Ray, I want to congratulate you on your award.
Thank you, Bob. It's a very unexpected honor, but I really truly appreciate it on behalf of our entire team here in Bandon, Oregon. I think we are doing some great special things in rural. I have devoted the majority of my career to working in rural healthcare. So this is a really special honor that I really appreciate. Thank you.
That's great and well deserved. I have to admit, Ray knew about it before today, so sadly we didn't surprise him, but we had to have him fill out paperwork. So we'll go to the next slide. So that's the last of my presentation piece. So again, if anybody wants these slides, let us know. Happy to be there. We're excited that you're all here for National Rural Health Day. And with that, I think we're gonna drop the slides and go into a conversation about why we're celebrating and what we should be celebrating in rural. So I've got a few statements that are often used when people say positive things about what's going on in rural. So I want to toss those out there and ask you all a little bit about your perspectives. But before I do this, one thing I forgot to mention when I was introducing Nathan was Nathan's a graduate of OHSU, and in his younger days as a student, he and two of his fellow classmates rode their bikes across the entire state of Oregon, arranging town halls in each of the communities they stopped in order to talk about rural health and the importance of rural health and why they were studying to go out and practice in rural communities. So it's one of those great things that we still tout about Nate and how he's done that. And I'm pretty sure you're getting ready to do that again at some point, right? And
we'd like to have a reunion tour, you bet. We're all pretty busy in practice right now, but at some point we'd love to do that.
Well, once we get the workforce issue all worked out and you've got more help out there,
yeah.
We'll get that done.
Yeah.
So one of the things is a statement here is rural America offers a beautiful landscape requiring unique approaches to healthcare. I'd love to hear you all talk a little bit about what you think that means. Leslie, you want to start?
Sure, I'll jump in on that one. I think unique approaches is a very polite way of saying we are under-resourced, and sometimes in order to get things done, we have to really think outside the box. I know in my particular rural area, the level of cooperation, the level of bringing people together to solve problems and issues is really unprecedented. I mean, we are just getting to the point where I think we all have a complex understanding, especially as we move through the pandemic, that we are all in this together in our geographic location, but there's not going to be the knight in shining armor swooping in to solve all of our problems. And if we have problems or issues that need to be addressed, then we need to sit around the table as a local, geographic healthcare, entities that are concerned and really come together and figure out how to solve them. And those conversations can be pretty unique sometimes, because sometimes you're sitting around talking to funders, people who can bring money to the table, but sometimes you're sitting around talking to people who can come up with cooperative ways to come up with workforce solutions. Sometimes it's people who bring a level of expertise or education to the table. And sometimes it's just community activists who may be your key to success. They may be stakeholders or influencers of others around. So yeah, that is a great way to describe us, and it is a very polite way to say some of the things that that we often talk about as just being sort of down and dirty. Is like, you just got to figure it out.
Yeah, I would love to tag along what Leslie said, if you don't mind, Bob. She's absolutely right. Collaboration is so critical and so important, and I've got some tangible examples that we're very proud of in our organization, in our community. Uh, you're absolutely right. None of us can do it alone. We do need to partner and work with other facilities and collaborators. We're actively working with the F2HC, which is right down the street from us. In the past, there was a bit of a rivalry between the F2HC and our critical access hospital and our clinic. But nowadays, actually, I meet regularly with the CEO of the F2HC, and we're talking about ways that we can work together. For example, the F2HC used to send, or currently does send, all of their reference laboratory work directly out to Quest, when they could be sending it to our hospital, which would be a huge benefit to our hospital, a way to keep critical healthcare dollars locally in the community. And by the end of this month, we hope to bring that contract back locally so that the F2HC is supporting our hospital. It works both ways. We're working on the social determinants of health right now. All of us are. The F2HC has a lot of resources for providing for food insecurities and the homeless population, and so we refer to them to help us out in all of those areas. But it extends even further than that. We also now are collaborating with our local tribal community and partners as well. And there's two tribes in our area, two tribal offices, the Coquille tribe and the Confederated Tribes of Coos County. The Confederated Tribes of Coos County is building a new health clinic. They've always had a dental clinic, but they're the only tribal entity, as far as I know, in the state that does not have a health clinic to serve their population. They're in the process of creating a new health clinic, but they too are working with us collaboratively so that we can support them through the health services that they need for their population, and we makes us better available and able to serve the community. So, and of course, we work with our hospital partners as well, but those are two collaborative efforts. One other example that I want to mention that Leslie reminded me of in terms of innovation and thinking outside the box and doing things that you don't normally see. Also very proud of the fact that our hospital provides the school nurse program in our community. The schools would not have a school nurse were it not for the collaborative partnership between our hospital and the school district, where the school nurse is our employee and is supported through our hospital, but is stationed in the schools, in the elementary school and other schools every single day to provide for the needs of our children in the school system.
Excellent.
Yeah. Yeah, and I can kind of piggyback on some of that too. I think that I agree that that's one way of saying that we're pretty under-resourced, maybe out in Baker County and other rural areas. But I think I really enjoy practicing in a smaller kind of healthcare system in a lot of ways, because you can't really wrap your head around it. When I need to get public health involved, I have all of our public health nurses on speed dial, and I can call them up, and we're on a first name basis, and kind of the same with our mental health providers in town and our ER doctors and kind of everything like that. And so I think that there's some real benefits to providing kind of full service health care and kind of wraparound care and just knowing everyone and knowing your resources. I think, one concrete example kind of how I think we're doing things very well in Baker County is we've got a thriving kind of Hep C treatment program that's going on. That's a collaboration between kind of our medical practice. There's a few of us treating Hep C. We're working with the local prison and also the mental health care provider in our community, and all kind of collaborating together to identify Hep C patients and get them treated in the easiest way possible. And in a place, and working with our health department to kind of do that as well and identify those patients. And so it's kind of exciting for me because in a place like Baker City, like we can kind of see that, we could, cure Baker County of hepatitis C pretty easily because it's easy for us to identify all those patients. And so that's a pretty kind of fun and satisfying part of being in rural Oregon and providing healthcare out here.
Yeah, excellent. Thank you. That's, and I think that's what we're really trying to show here, right? And as we celebrate National Health Day, is these are the positive things, and there's a lot of great stuff going on. And you can go into an urban area and come up with a list of a lot of problems too, but there are so many big successes. So it's great to hear those. Another statement, rural America is a great place for mission-minded professionals to provide individualized care. And that speaks a little bit, I think, to what you were saying, Dean, if you wanted to kind of take a jab at that one. And
Yeah. I mean, and I can give a little bit more of kind of my backstory too. So I'm from Baker County originally. The rest of my family, I have a lot of family in Baker County. I'm a fifth generation cattle rancher out here. Most of the rest of my family are all involved in agriculture in Baker County. And so kind of when I went to medical school at OHSU, my plan was to return to Eastern Oregon, to Baker County, to be able to provide care here. And so, I know on a personal level, a lot of the patients I take care of out here, and it really was kind of a mission-based thing for me coming back to this area. But I would say the same about all of my colleagues that work here too. They really do this because they love taking care of people. They love living in this area, and they love the work they get to do in medicine. I think that to me, it's really satisfying that here I can really decide how I'm going to provide care, and what setting that's in. I still do, I'm a doctor that still gets to do home calls and home visits, which I think is really satisfying. I take care of whole families out here, and so I know kind of generations of family, and that's really satisfying to me. I take care of people in the hospital and out in the clinic and in their homes, and so to me, that's just a really satisfying way to live. And I do consider my career kind of it's not just a vocation, it really is kind of a way of life for me out here, and I really love it. And so for me, that's a positive.
excellent. Thanks. Ray.
Yeah, thanks, Bob. And the same goes for me as well. I'm originally from an urban area, born and raised in Los Angeles, California. So my early formative years were in the Los Angeles area, and I attended USC for my college degree and got my master's degree in healthcare administration from USC at age 24. And I've worked in all types of settings, as large as 400-bed teaching hospitals and as small as 21-bed critical access hospitals. And I've really gravitated towards, from my own personal preference and perspective, the smaller rural areas. I chose to come to Bandon, Oregon last year because it was a small rural critical access hospital. And I have 25 years of previous experience working at the CEO level in critical access hospitals. I worked in Montana, I worked in New Mexico, I worked in rural areas of California as well. In Texas, I actually worked in an urban area in Fort Worth. But I really enjoy working in a small facility where you know all the employees by name. I know all of our employees and I know their backstories. I know how things are with the family during new employee orientation. I'm the first person that meets with all of our new employees. I want them to get to know me. I want to get to know them because it is a very personal family experience. And I agree with your statement, Bob, and what Dean said as well. It is a mission for most of us here. Our CFO and our CNO were both born and raised in Bandon and have family here and are here to support family. But our clinic manager came from John Day, Oregon, and she loves the rural areas and her family loves it as well. And the providers that we bring into our area, it's always a concern whether or not they're a fit for a rural area. But we found that the people that choose to come here and work here love it here, and they love being that provider for such an important part of this local community.
Yeah, Leslie.
Yeah, I have a very similar backstory. It's just my rural was from the Southeast. That's where I grew up and adopted Oregon. But much like Dr. DeFries, I knew when I was in residency at OHSU as well that I was not going to stay there. I knew that rural was where I wanted to be, and so came out to the coast and then I have been here ever since. And you just start, loving the place, loving the people. And I think the mission grows, right? Especially since we have run up against more workforce issues, more complex patients. And I know we always say that in rural, but it really is true. It's not anecdotal anymore. I think we have a lot of numbers to say that that we have patients who are complex in every way, including behavioral and mental health issues, substance use disorders. And so we've had to come at things differently. And because we're mission driven, right, then we can spread our wings and say, well, it's not exactly our traditional healthcare routes, but we still have to get at this and we still have to solve this problem. So for example, we have our county, every municipality, our two tribes in the area, all of the individual donors that you can think of, our state government, our federal government, numerous foundations, all coming together to build a substance use disorder inpatient treatment facility, because we are sending our people miles and miles and miles and miles away to get that level of care. And so that will be the first in Lincoln County, and we are just we can't build it fast enough to satisfy the need. And then likewise, expanded our mission to include childcare. We have an early learning center affiliated with our Samaritan North Lincoln campus, just right across from the hospital. And so while it helps our workforce, it's a mission for the social determinants of health, right? And having kids from all backgrounds, and certainly some families who cannot afford to place their children in an early learning program, have that level of education from the beginning. And we have figured out ways to make that happen, in our area, with a lot of philanthropic support, actually, a lot of good people wanting to pay it forward and continuing to provide for educational opportunities in our world. So it's taken all of us working together, and our mission just keeps growing. But what a great mission to have.
So you touch on something I think that probably none of the three of you thought you'd be doing as much of when you went into the healthcare fields, and that is the social determinants ends of pieces. More of the things that we need to do for health versus for the healthcare. it's become extremely important over the last number of years. It's become more important and focus of our office's work. So, how do you all see that? I mean, how do you see that change having happened? And where do you think it's going to go for your role as either a provider or as an administrator in healthcare when you're suddenly taking on roles of advocates for housing and advocates for transportation and these other pieces that you didn't know when you started this career?
Yeah, maybe I can start with that a little bit. You know, I think I'm actually really hopeful about that in the state of Oregon. I think that you know, we're getting, you know, from a provider standpoint, from a health clinic standpoint, we're getting paid differently to take care of our patients in unique ways. And so I think that it's getting a lot easier to be reimbursed for a lot of those things. Probably doctors have been doing here in Baker County for decades or, you know, centuries. But you know, we're able to provide kind of more mental health services, I think, now in Baker County probably than we've ever been able to provide. We've got more social worker, more community health worker support, yeah, mental health care providers and substance abuse treatment here than we've ever had because of the way the funding streams are changing in the state of Oregon. So I think I think I'm hopeful that things are actually kind of improving there, and we're moving in the right direction. I think that you know, outside of my job as a physician, you know, in a rural area, I do feel like it's my obligation to, in my civic duty, to kind of help with a lot of those other social determinants of health. And so make sure that our education program is strong, make sure that our housing and zoning kind of laws are going well and that our community is functioning well. And so I spend a lot of my time outside of work kind of, you know, at city council meetings or that sort of thing, kind of working on other school board meetings. So I think there's a lot of that we all do in rural areas, outside of our work too.
Yeah, and I'll jump in and just add that, yeah, I never thought I would be spending as much time on some of the issues that are not traditional healthcare issues, but certainly tied back to social determinants of health. And it is exciting. Like Dr. DeFries said, it's exciting to see us recognize that we're not really going to work to higher health outcomes until we can solve some of the factors that have brought people there. And so, so to say, you know, I was part of a solution for housing, you know, on the coast, and we spent a long time working on this stuff, and we're actually, you know, getting some stuff done. I can, you know, drive up and down the road and see housing developments going in, and, you know, that I wrote letters of support for, or stood up in front of city council and said, you know, to all those NIMBY people that not in my backyard, like you can't say that anymore. We have to have this, and really pushing those decisions forward and making sure that they happen. And so, so, you know, everything from housing to education to, like we said, you know, expansion of the substance use and mental health sort of realms. I mean, all of these are valid things that we're doing. We're even partnering with the county now, and our health plans in the region, our CCO, to figure out how to provide homeless shelters in, you know, 2 of our towns in our county, because we cannot have people dying on our streets. We cannot, and we're saying no more. And so, yeah, it's really a blessing. It is really amazing to see that mission grow and to see us being able to influence and or contribute directly to solutions.
Yes, and thank you. I absolutely agree with everything that Leslie and Dr. DeFries said as well. And it is an exciting time to be part of community health and community solutions. I'm excited about the fact that this year with the holiday season coming up, our community is banding together to provide holiday meals for less fortunate people in our community that don't have a place to go for the holidays. So through a cooperative effort, and our hospital and our dietary team in particular is supporting. We are working cooperatively. There's a GoFundMe effort that's going on in the community to help raise funds. Restaurants are participating and donating facilities and space. Our city is donating facilities and space to provide for holiday meals this year, and that's very exciting. I had talked a little bit previously about collaboration with the FQHC down the street because Bob, one of the things that we've realized as a hospital is we don't have a lot of core competency in a lot of the social determinants of health areas, and the FQHC does. So we feel like we can best serve our community and best serve our patients by working cooperatively with that organization and helping them and allowing them to help us as well.
That's great. And our office, we have a program manager now on staff who focuses on social determinants of health. So also there to support you all in the work you're doing. We've got a couple comments in as y'all have been talking. One, Connie was talking about her role in Curry County in accessing healthcare, suicide prevention, and housing, as well as the VA and mental health advocacy in the Roseburg area, and working part-time for Representative Boyce. So thank you, Connie, for that work and seeing how it all ties together. And the importance of making sure it all ties together, that people know what's going on out there, and we're not recreating wheels when we can build on what's already there. And another comment, which takes me to another question I have for you all. Patty Barfield, another bright star from Eastern Oregon, and a great person, has noted that MPs help meet a lot of rural health needs. And I think it would be interesting to get your perspective, because I think NPs and PAs and the practicing to the highest level of your licensure and the impact that workforce shortages have had across the board. If you can talk about how the teams work together and the important role that MPs play as well in your communities.
I'd be happy to start, Bob, because we're really excited about opportunities for nurse practitioners in particular in our facility. We've had a real crisis in our emergency room over the last year, with a great deal of difficulty to recruit emergency department physicians to come work in our facility. And when we can find them, they're very expensive. I would say unaffordable for our facility. It's really been a struggle for our facility to maintain 24-hour-a-day, 365-day-a-year coverage in our emergency department. But we have taken the step of utilizing nurse practitioners in our emergency department. We started doing it in September of this year, and it's been very successful. We don't entirely staff with nurse practitioners. We use them to supplement our physician staffing, but we do use nurse practitioners working solo by themselves in the emergency department without working side by side with a supervising physician. And it's been very effective for us. We have found that there are very talented nurse practitioners that have years, in some cases decades of experience working in emergency departments, and can be very effective. So for the shortage of emergency trained providers, it's been a real benefit to our facility, and we plan to continue doing that in the future. We also, obviously, as all the other facilities do, rely upon nurse practitioners in our rural health clinic, even in a leadership role. The medical director in our clinic is now a nurse practitioner, because we had a nurse practitioner who has a lot of administrative experience and really was looking for a leadership role and has been a very valuable resource and aid to our entire staff. We really appreciate what she's doing. So nurse practitioners are a very vital part of our team.
Yeah, and I can echo that. I mean, what Ray is saying is absolutely true. I mean, we saw years ago that our population was growing faster than our core of physicians and other, traditional historical care providers. And of course, the answer to our needs is that diversity of care providers who then are independent nurse practitioners, as well as PAs who work either independently in some cases or alongside our physicians. And we saw a similar type of evolution where folks were working in primary care. Our advanced practice clinicians started there, but now have moved into pretty much every aspect of care within the hospital and outside the hospital, and particularly into specialist areas where we now have our teams working. So we have teams of care providers in the primary care setting, but also even hospitalists. We have hospitalist physicians and hospitalist APCs. Likewise, in the emergency department, we have physicians working right alongside our APCs, and even in the specialty areas where we might just have one physician that maybe even comes in and works maybe even a week, a month, or just here and there. Well, you can add and stabilize your service lines with APCs and filling in those gaps and really building, number one, a much more cohesive team that is better for the community. But number two, you're stretching your workforce, working them at the top of their licenses, and really seeing a difference in the type of care that you can give and really maximize for your community. So, oh my gosh, yes, we could not function if we didn't have all of our team members. And I think just the plug that I think we can all endorse is, if you're looking for a job and you want to come to one of our fantastic places, we probably have an opening for you.
Yeah, and I just, I work on a team every day, kind of with nurse practitioners and physician assistants. I'm the medical director out at a Frontier clinic that's staffed 4 days a week by a physician assistant, and it's 60 miles from Baker City and on the edge of the Hells Canyon area, and I go out there twice a month and help support her, and we work really well together and bounce things off each other. And yeah, on my team, kind of here in Baker City, I've got a nurse practitioner that I work with every day, and we really rely on each other to practice at the top of our license and to help each other out. And so I think, anymore in healthcare, you've got to be working in teams to be successful at all. Can't go it alone, really.
So the last kind of big question I was going to ask you was, rural America is fueling an innovative rural health infrastructure. I think you guys have addressed that in almost everything that you've said today about partnering, looking at different funding sources, at the way we utilize our providers, and just trying to solve come up with solutions in our own communities. So I want to kind of ask this question of each of you. You're standing in front of a room of people, and this group of people is high school students all the way up to undergraduates, and they are at a career fair, and you are going to talk to them about healthcare. What would you say to them about going into healthcare, and what would you say to them about practicing in a rural community?
Yeah, I think that one's really easy for me. I can speak personally, the fact that I just love what I get to do every single day. I enjoy my work. I get to choose what I do a lot of the time and have flexibility in that way and really get a lot of meaning out of the work that I do. And so, yeah, to me, I think that's, I love my work, and I'm sure that would be the case in an urban area or suburban area or internationally or in a lot of different places. But I think in kind of rural America, I get to spend a lot of time outside when I'm not at work. I get to really know my patients, and it does feel like a big extended family kind of here in Baker County. So I think I get a lot of satisfaction out of what I get to do.
Good, thanks. Ray or Leslie?
Yeah, I would say that I wrestle with what people don't know about healthcare. Like a lot of people know what doctors do. Some people know what nurses do. They might not know the full depth and breadth of what our nurses do, but they have an idea about the bedside sometimes. But what they don't understand is that we have such a diversity of jobs. We have everything from, if you're science oriented and you want to get into the lab or imaging and become a technologist. We take care of patients in all ways, from nutrition. So if your calling is food service, if you're a culinary genius, there is a job for you in healthcare. If you are just an amazing person who takes care of others and can come in and do some of our environmental services work. That is some of the most important things that we do, is take care of people in a clean, sterile environment. And so I just we've been going into our different settings when we are able to touch base with those folks in high school and maybe even younger and maybe even older in some cases, and really trying to show them the different roles that they can play and interest them in what we've got going on, and then help them understand what educational pathway it might take to get them there, because all of these are skilled positions. And I think people don't quite understand that. But a lot of them, we will train you. We will make sure that you are skilled. And some of that you can do on the job in apprenticeship programs. Some of that we'll do as a natural part of the job. Some of it we can help you get there, right? If you want to become a nurse practitioner and you want to start as a nursing assistant, we can plot a path for you to get there. It's just getting that information to the kids and to the people who are at that stage in their career process. Because there are so many different ways to get there as well. And you just have to sort of sit down with somebody who has that information and that knowledge and figure it all out. But I would tell somebody, you need to be in healthcare because, number one, you will never not have a job. And number two, you can have a job anywhere you want in our nation or the world. And it is a great career for those people who care about helping someone else. And we can show you the way, whatever you're interested in.
Yes, I don't know if I could articulate any better than Leslie. She just did a great job and took the words out of my mouth in many regards. When I'm in situations just like the one that you described, Bob, speaking to an audience of kids or participating in a job fair, that's exactly what I say. Is there are so many different opportunities in the healthcare field, from medical imaging to pharmacy to environmental services, just like Leslie said, and there's something for everybody. And I think it ties into what we talked about earlier in our conversation today about rural communities and a sense of, I loved what Nathan said about extended family, because that's pretty much what it is. We're an extended family. I mentioned earlier in my comments that both our CFO and our CNO are homegrown kids themselves. And our CFO went to Oregon State University and then went to work for Salem Health and their finance department, and came back a few years ago because this is where his family is, and this is where he felt like he wanted to make a contribution to help his hometown hospital grow and reach its highest potential and the next level. So this is a great opportunity for young people to have a job right here locally at home and continue to be a part of the family. They also have the opportunity to travel and work anywhere in the world, just like Leslie said a moment ago. But we offer lots of good paying, excellent, benefited positions right here in the local community. And we do help kids reach their highest potential as well. And we have a hospital foundation, and probably the most popular program that our hospital foundation sponsors is scholarship programs for kids. And most of the scholarship applicants that we get actually are hospital employees, hospital employees that want to go back and get their nurse practitioner degree, or in one case, you get their CPA degree, or medical imaging, or become a nurse. And it's very, very common. We have EVS staff that are pursuing nursing education, but it's because we have this sense of extended family in the community, and people love this community and want to be a part of it, that we're able to provide those opportunities to grow in their profession and reach their highest potential, and serve a critical role in providing for the healthcare of our community. It's an easy question to answer, just like Nathan said.
That's great. I agree with you. It is trying to get that information to the students and really understanding what opportunity is out there is such a challenge, and one that we continue to work with the area health education centers and others on to get that next generation of kids involved, because if we don't, the struggle for this workforce is going to continue on and on and on. It's not something that's just going to go away. So we have 4 minutes left. So I saved the easiest question for last. So we have a lot of experience here. We have a family physician from Eastern Oregon. We have a CEO from the South Coast, and we have an emergency room physician who's also a CEO. So you see this all from a lot of perspective. You can ask for one change in the healthcare system that would improve rural healthcare. Just one. What would that be? You're on mute, Nate. Nathan, you're on mute. Sorry. It was a great idea, but you were on mute.
I just said something great. Yeah, no, I mean, I'll say single payer healthcare is, I think would make things so much easier.
Yeah, I want to ask for something that is meaningful to the patients themselves, and something surrounding their care that is so diverse. But I think Nathan's got it right. Like, the one thing that would continue to make sure that we are sustainable and that we can continue to give care is to figure out the back end of healthcare. Figure out how we're paid, make sure it's consistent, make sure it's sustainable, and then we can listen to our patients and their needs, and then design and deliver that healthcare that they need. But the trouble right now is we wrestle with how are we going to continue to deliver high quality healthcare with a payment system that can change month to month or day to day, and can really impact our ability to continue to do so. So I'm going to have to go with the very unglamorous, let's redo our financial system.
Well, it's really difficult to top that. And I absolutely agree with everything that both Dr. Ogden and Dr. DeFries said. If I could wave a magic wand and change one thing in the healthcare system, I mean, I think that it would be, of course, more resources for mental health illnesses. And there's such a crisis in mental health in our part of the state, and I think statewide, maybe nationwide. I heard a really good quote. Actually, I participated a couple days ago in a town hall meeting that our local legislators, Senator David Brock Smith and the president of the Senate came down and did a listening session in Bandon, Oregon, and I thought that Brian Moore, the CEO at Bay Area Hospital, spoke very eloquently about the mental health crisis and had a really great comment. I mean, he started out talking about the trauma system and talking about the fact in the trauma system, we have a very well-defined system, which includes level 4 trauma facilities. They handle everything that they can handle, and when they can't, they'll refer up to a level 3 or a level 2 or even a level 1. And whenever there is a trauma event that occurs and a call needs to be placed to a higher level of care facility, the answer is always yes. Send the patient. We can take care of the patient. But he said when it comes to the mental health area and mental health field, it's quite a different story. If a mental health individual who's challenged, if a patient is challenged in that area, arrives in our facility, there's oftentimes no place to go, no place to refer, and the facility that has the patient is left trying to deal with it. I was really encouraged actually by what I heard Dr. Ogden talk about a little bit ago about some of the creative things that they're doing up in Lincoln County and collaborative effort to build new facilities. That's wonderful to hear. I think we need more of them. We need more of what they're doing in Lincoln County and more throughout the state.
And I would add one of the attendees, Jennifer, included that more providers and shorter wait times for new patients, which I think what you all have talked about sort of addresses those pieces as well.
Yep.
Well, we've come to the top of the hour, and while I would love to sit and keep talking, I know that everybody has to get back to work. And I really, really want to thank all three of you for joining us today, and all of you that are here joining us to listen. It's been a great day for National Rural Health Day. Again, congratulations, Ray, and thank you all for everything that you do for rural.
Thank you,
Happy
Bob.
Rural Health Day.
Thank you.
Thanks, everybody. Bye.